Recognizing the symptoms of heart attack in a woman can actually be challenging because the presentation of heart attack in women is not the typical chest clutching, strenuous chest pain that men have. And we have all been skewed to think that that is how heart attacks always present. I'm here to tell you that that is not very correct. Heart attack often presents in other ways in women. And that is what I want to share on this podcast. I'm going to be sharing today the typical presentation of heart attack in women, the subtle signs that the heart is giving women that they should not miss, the causes of heart disease in women, how to prevent heart disease in women, and the management of heart disease. So stay with me on this podcast today. My name is Dr. B. I'm a public health physician. I promote health literacy and I break down complex health conditions in an easy to understand way so that you can make the best decisions for your health. Globally, heart disease, cardiovascular diseases generally account for over 6,400 per 100,000 women. That's the prevalence. And in the US alone, the prevalence is more than 44%. That means out of every 100 women, 44 of them have a cardiovascular disease. And it is responsible for about 35% of deaths in women globally. This is from 2019 statistics, and that's a lot when you think about it. 35% simply means that out of 100 women, 35% died from cardiovascular disease. So let's talk about this. It's not something to be afraid of, it's just something to know so that you can prevent or manage it appropriately. Knowing those alarming statistics and knowing it is real, I want to first of all explain what cardiovascular diseases are. Cardiovascular diseases are a bucket list of diseases that impact the function of the heart. And you have things like hypertension, that is top on the list and very common. We have arterial heart diseases. We have peripheral arterial diseases. We have cardiomyopathies. That means the muscles of the heart have something going wrong with them. And usually in women, this either happens when a woman is pregnant or postpartum. So we call that postpartum cardiomyopathy and some other types of cardiovascular diseases. Just letting you know that cardiovascular diseases is actually a list of diseases. So it's not just one item that makes up cardiovascular diseases. So we're going to be focused on cardiovascular diseases generally. And these cardiovascular diseases can cause heart attack in women. Now that you know what cardiovascular diseases are, at least you are aware of hypertension, which is the most common. The other thing I want you to know is that, like I said earlier, the presentation is atypical. It's not the typical chest clutching presentation that most women have when something is going on with the heart. Sometimes they just feel fatigued. Sometimes they just feel it is stress. Sometimes they think it's muscle strain. And sometimes even physicians miss it because the woman walked in herself. The woman is talking about the symptoms. And because she doesn't look like someone dying, it is often missed. So now, what are some of the common symptoms that women have that could actually show that a cardiovascular disease is going on? Decreased ability to exercise. So the energy is just not there. For someone who could do some exercise before, the ability to exercise is now diminished. Fatigue that would not go away. Yeah, we all get fatigued. I mean, we get stressed. We have so many things we're dealing with and we get fatigued. But when you rest, the fatigue should go away and you should feel better. But if fatigue is not going away, it's a symptom of cardiovascular disease. Lack of energy. frequent complaint about indigestion. So it looks like, oh, it's heartburn, it's indigestion, and it is so frequent. It might actually be pointing to the fact that a cardiovascular event is going on. Palpitations, swelling in the ankles and in the feet, trouble breathing when sleeping. So the woman is sleeping, but it's so hard for her to breathe. Those are common symptoms of cardiovascular diseases in women. So you see, it's not the typical presentation like men we have. And then sometimes when the symptom is getting really bad, it is becoming an emergency when a woman breaks into cold sweats, when there is chest pain that goes straight to the jaw, to the arm, or to the chin area generally. It's a pain that radiates from the chest into those areas. Or dizziness, lightheadedness. When a woman has that, it is an emergency symptom. This woman needs urgent care. Sometimes it could present with nausea and vomiting and severe tiredness. So those are now emergency symptoms. Now that we have talked about the common symptoms and the emergency symptoms of cardiovascular diseases, I want us to also talk a bit about why it occurs later in women. So in women, you don't see many young women have heart attack. And have you ever wondered why? It's because estrogen, the predominant hormone in women, actually protects the heart. Yes, we are that blessed. So estrogen protects the heart in women. And cardiovascular diseases, heart attacks start to happen many times in women after menopause. And that's why you really need to understand the establishment of menopause. And you don't have to wait until menopause to say, oh, I'm protected. You can prevent events that will lead to a cardiovascular disease or a heart disease. So estrogen protects the heart in women. And when menopause hits and is established, estrogen is gone. So they are exposed. So women who are at risk can now have, you know, heart attack or any cardiovascular event happening. And that is why in middle age, that is why when you are young, do things that are protective of the heart so that when estrogen is no longer there in the amount that you used to have, because we still have some extra gonadal production of estrogen. I don't want to bore you with those details, but the quantities are not sufficient. That is the basic thing that is happening at menopause. So when that protective estrogen is no longer there, you already have put yourself in a good place to protect your heart from having a heart attack. The other thing I would want every woman to know is that cardiovascular diseases are preventable. These are simple steps that a woman can take to prevent a heart attack and to prevent cardiovascular diseases. Number one, eat nutritious diets that includes heart-friendly vegetables, proteins, whole grains. Like I tell people, eat from the earth. Color your plate. You are not likely to go wrong when you follow that rule of thumb. Number two, limit the intake of processed food. When you eat from the earth, you will limit processed foods. Yes, there are days it's just so hard to fix food at dinner, to fix lunch for the family, but please do not make that your go-to. Eating processed foods, ultra processed foods, trans fats, processed sugars, those are not healthy because they contain a lot of saturated fat. They contain a lot of the LDL cholesterol, the one we call the bad cholesterol. Many times the salt amount in them is so high, and it's also important that you start checking nutrition labels. I can't vouch for any nutrition label, but there's no harm in checking and be sure of what you are taking into you. Like I'm trying to do now. Yes, I'm owning up because I've always been guilty of taking soda, but I'm winning myself, and my go to now is water or green tea. So look for a good substitute. It can be challenging when you're weaning yourself. It was so hard for me to wean myself off Coke. I'm not calling out Coke. It's just the best soda I would ever take. But wean yourself off soda, wean yourself off sugary drinks. We call them pineapple juice, orange juice, apple juice, but you know it's just loaded with sugar. If you need to take those juices, ensure that it is as natural as possible, and always check the nutrition label. You see it there. You will see the percentage of sugar, you see the calorie it's giving you, and you see the um, amount of the fruit that it contains. Also, choose healthier sources of fats. Get your oil from nuts and from seed. And one of the best heart protective oils as is known to be olive oil. Olive oil. It's expensive, it's pricey. I don't cook with it all the time, but I take shots at it. What I'm saying here is don't go break the bank because, oh, Dr. B says that olive oil it is. Olive oil is good, but try to avoid animal oil as much as you can. Use plant-based oil, nut-based oil, seed-based oil. Make exercise very regular. Consistency of exercise is more important than the intensity. The recommendation is that you do at least 150 minutes of exercise in a week. But if you cannot do that yet, do what you can, but make it consistent. Walk around in the house if you work remotely. Go to the washroom upstairs. Use the staircase multiple times. Now that we are in summer, take brisk walks, walk regularly as much as you can. I always say it's not always about eating the gym, it's about ensuring that there is constant movement of your body. And do that and make it consistent. Remember, it's not intensity that matters, it is consistency that matters. And this is a bit off because this is not really just about heart health, but I would say that women, perimenopause, and postmenopause need a combination of not just movement, but also muscle strengthening and joint strengthening exercise, what we call resistance exercise. So you need to use those dumbbells, yes, at perimenopause, because when estrogen also starts to decline and muscle mass is being lost and bone density is reducing, it's all these exercises that has been built in that keeps things together. Limit the intake of alcohol if you take alcohol. Limit the intake significantly because alcohol has been associated with high levels of blood pressure and it can increase the risk of cardiovascular diseases. Stop smoking if you still smoke. Try to stop smoking. Join the groups where people are trying to quit smoking and look at safe alternatives that you can use to win yourself. And I mean, if you are spiritual like me, you can always pray about anything if you really desire to stop and you know that this is a burden. In addition to quitting it, ask God for help and it will help you to actually stop it. So, those are simple steps to prevent heart attack and cardiovascular disease in women. And for women who already have a cardiovascular disease going on, how can we manage or treat it to prevent what we call a cardiovascular event, to prevent a heart attack, to prevent a stroke, to prevent, you know, something we don't want happening? Number one, manage your stress. Manage your stress. Many events that have happened in women has been linked to periods, hectic periods in their lives when a woman is going through crisis of divorce or going through many challenging times. The pressure, the psychological effect of this has been linked to increased risk in cardiovascular diseases. So women, manage your stress so you can manage your risk. Chronic stress is no good for anybody, especially women. Another way that hypertension can be managed is to check your blood pressure regularly and check the numbers. What numbers am I talking about? Your cholesterol numbers. You must know them annually. And you should do your total cholesterol, your low density lipoproteins, LDL, your high density lipoproteins, the one we call the good cholesterol. The LDL, we call it the bad cholesterol. You need both. And that's why you should know the good cholesterol, because your good cholesterol should be, when it's too low, it's a problem. And then the bad cholesterol should not be high. So you should know those numbers every year. You should also know your total cholesterol, because that also matters. You shouldn't have higher than the desired total. There's always a range. You should be within the safe range. And if you are above the safe range in the lousy and in the total, there are medications that can be given to reduce that. And there are also the diets, the heart friendly diets, if you're consistent with them, can actually help with some of these things. For established hypertension, for those who really have bad blood pressures, in terms of it's really high, I already did a podcast on hypertension. You might want to watch that to know the details of hypertension. Hypertension can be managed, hypertension can be treated. And I know that there are claims to foods that actually help to produce more of nitric oxide that helps to dilate the vessels and keep the blood pressure low. But that is not the focus today. But for no reason should you not know your blood pressure numbers, and for no reason should your blood pressure remain elevated without you doing something about it. So, women, go know your blood pressure. No, you should have a blood pressure machine at home, and you should check your blood pressure regularly. And if it is high, please go see your physician and get that sorted out. And if there are other conditions going on, there are ways to manage it. And for those who already have established heart diseases, there are things that cardiovascular surgeons and cardiologists will recommend that keep women alive. The insertion of the pacemakers are there that can be done. Bypass surgeries that are now being done, I mean, those are a bit more complex. It's to prevent an eventual heart attack from happening. But for those things to be done, there's a significant block already. But what we are trying really is to prevent that cardiovascular complication from happening, such that it doesn't have to get there. But if that is the solution, it is still better than having a heart attack, which no one is sure of surviving. So if you have learned something from this video, please share with a friend, share with every woman you know, share with everybody, because they have a wife, they have a sister, they have a mom, they are connected to women in their workplaces as well, because it is just so important that we understand that heart attack in women is real and can go very unnoticed, can be silent, and the next thing might be a heart attack. And sometimes it's too late. And I don't want that to happen to anyone. Take good care of your health. And until the next episode, I remain Dr. B. Bye for now. Stay well, and God bless you.